In news from Jamaica, there are still more questions than answers. The country is demanding more information about the 42 babies that have been infected by the Klebsiella and the serratia viruses since June. The outbreak took place at the University Hospital of the West Indies and the Cornwall Regional Hospital. 18 babies have died as a result of the viruses, and the health minister Dr. Fenton Ferguson says he was only informed on Friday. Candice Ming has been tracking this story.
Jamaica's Ministry of Health says the infections that have flared up in 2 hospitals recently is not a new occurrence. In fact, national microbiologist Dr. Karen Webster says outbreaks in the neonatal units occur from time to time, and this year there have been 4 outbreaks, 2 at Cornwall Regional and 2 at the University Hospital of the West Indies.
Klebsiella was isolated in both outbreaks in Cornwall Regional and in 1 outbreak at University of the West Indies. The other organism at UWI was serratia. We had a look to see what was the infection rate in the hospitals that we had outbreaks in. For this year, they had similar rates of about 8.4 and 8.5 respectively. In high-income countries, this is general hospital figures of 5 to 15%, and for low and middle income, this is 5.7 to 19.1%.
Dr. Webster, in giving details of the outbreak, says the normal ratio of infants being infected at hospital within days after birth ranges from 12 to 55% in developing countries, Jamaica included.
Cornwall Regional Hospital, the first outbreak, we had 7 babies being infected and 4 died. Cornwall, the current outbreak of Klebsiella, 14 were infected and 6 babies died. University Hospital of the West Indies, the first outbreak was serratia. 8 babies were infected and 1 died. At UWI, Klebsiella, the current outbreak, 13 cases and 7 babies died.
She shared what immediate actions were taken to control the outbreak.
At the Cornwall Regional Hospital, the babies were isolated. The infected babies went into separate rooms. New admissions were placed in a different location. Additional equipment and supplies were purchased, and staffing levels were enhanced by redeploying staff members and engaging additional staff. With respect to infection prevention and control, the increased monitoring of hand washing practices done by the Infection Control Committee and the Public Health Department. Re-education and training of hospital staff, orientation and training for parents, increased cleaning frequency of the special care nursery, patient, staff, and parents' movements were restricted. Movement of staff from room to room was restricted, and no restricted items were allowed in the special care nursery, such as cell phones and food.
Meanwhile, Jamaica's Minister of Health, Dr. Fenton Ferguson, finally responded to the cases of infections which resulted in the death of 80 newborn infants at 2 of the island's major healthcare facilities. He says the solution to the alarming bacteria infections is PROMAC. The Program for the Reduction of Maternity and Child Mortality, or PROMAC for short, is a project to modernize and expand the nation's maternal care services and improve the quality of care to premature infants and high-risk pregnant women. The €22 million project is funded by the European Union. Minister of Health Dr. Ferguson says under PROMAC, the capacity of obstetric high-dependency units, HDUs, will be increased at the 4 referral regional hospitals, Cornwall Regional, Mandeville Regional, St. Anne's Bay Regional and Spanish Town hospitals, as well as the Victoria Jubilee Hospital. This amounts to a total of 23 beds across the 5 institutions. Additionally, the delivery area and the maternal fetal clinic at the Victoria Jubilee Hospital will be rehabilitated in entirety. The minister says this process is far advanced.
Contracts amounting to a total of 1,792,943 euros, or close to 243 million Jamaican dollars, have been awarded as follows. 200 million, or a little over 27 million, for design services for the maternal and neonatal HDUs at Victoria Jubilee, Mandeville Regional and Cornwall Regional. 270,000 euros, or 36.5 million, for Bustamante Hospital for Children, Spanish Town and St. Anne's Bay Regional Hospital. 491,000, or close to 66.4 million Jamaican, for equipment for Mandeville Regional Hospital Neonatal High Dependency Unit and ambulances. 99,943 euros, or 13.52 million, for testing equipment for HDUs. 100,000 euros, or 13.53 million Jamaican dollars, for design services for 4 primary care centers.
Those primary care centers are the Savannah Lamar, St. Diego Park, Mandeville Comprehensive and Anotta Bay Health Centers. 2 community hospitals will also be in the mix. Those are in Alexandria St. Anne and Chapelton Clarendon. The health minister says 632,000 euros will be earmarked to acquire 6 ambulances, and arrangements are being finalized at this time to procure equipment for 10 remaining HDUs at a cost of 2.65 million euros. He adds that the new equipment is being coupled with the appropriate training of medical staff. Candice Ming, CEEN Caribbean News.
Thanks, Candice. Meanwhile, the opposition Jamaica Labour Party, JLP, isn't convinced that the Health Ministry is on top of things. Opposition spokesperson Health Marlene Malawi-Fort says while the Health Minister Dr. Fenton Ferguson has announced long-term solution, what is needed right now are immediate answers.
I don't think any right-thinking Jamaican is satisfied with the announcement or the performance of the minister. The problem requires an immediate solution. The hospitals need to be cleaned, disinfected, thoroughly cleaned, and there also needs to be other action steps taken in the short term, in the medium term, and in the long term. But the minister has shown that under his watch, we can hold no confidence that these problems will be dealt with appropriately.
Mrs. Malawi-Fort also sides with the youth arm of the JLP Generation 2000, calling for the health minister to step down.
I've said before, and I will say again, in any self-respecting government, the minister would have resigned or the prime minister would have relieved him of the responsibilities as health minister. Let the people judge for themselves what this government is dishing out to all of us.